station.
It's 3:36. Helen with you through until 5 o'clock. We're talking love after 4. Is there such thing as soulmates? How compatible? What is compatibility? Are we attracted to our opposites? And what is going on with this viral theory on TikTok about golden retrievers and black cats in relationships? Dr. Thryer has some strong opinions on this. We're going to be getting those after 4 o'clock. But right here, right now, I want to know your love story. Tell me, how did you meet your partner? On 4001. You can let me know on the ARN Play app or the WhatsApp. Please put your name on it. We want to treat you and your beloved to an amazing kind of activity, fitness-focused night away at the Syro One Zabeel. It's the ultimate hotel for an active lifestyle. The gym is amazing. So not only will you get a one-night stay for 2 with breakfast, get the shakshuka, it was incredible, but you'll also get a 1-month gold membership for one person too. It is just 15 minutes from the airport, steps away from Dubai World Trade Center. The fitness lab is truly outstanding, and there's group classes there as well. And if you love your food, it's directly connected to the link, which has got restaurants with a few Michelin stars as of last week. So tell me your love story. And I have to say, it's lovely to hear them in your own voice too.
I met my wife in the church center last 2008 while she was preparing a PowerPoint presentation for a church service. It started from there, and after all the waiting, we tied the knot on 2009. And it's already 14 years in marriage and counting.
Oh, June, thank you for that. Keep them coming in, 4001. Love to hear those. Love. Want to treat you to something really special to look forward to. A one-night stay at the Syro One Zabeel and a gym membership too.
This is Afternoons with Helen Farmer on Dubai Eye 103.8.
With Mubadala Health Dubai, a specialty clinic and day surgery centre for every stage of your family's life. Trusted for care. Call 800-77.
I knew this doctor was going to be popular. Dr. Mohammad Ghatali is with us today, consultant neurologist at Mubadala Health. We are talking headaches, migraines, prevention, treatment and more. And unsurprisingly, lots of messages coming in. Some long, some short, some general, some specific. No name on this one saying, is migraine a diagnosis by exclusion? How do you diagnose a migraine? Is it clinical or is it by exclusion?
Usually when we see the patient with migraine symptom, it's clinical diagnosis. Every migraine, you don't need to do MRI imaging. By semiology, typical semiology of throbbing, localized in different side of the head, lasted 4 hours to 72 hours.
Oof, that's a lot.
And then aggravating sensitivity to light and noise, those or we can categorize with the migraine.
Okay. Marianne saying, now and then I get eye migraines, as it was once diagnosed. Crazy shapes in front of my eyes and then headache. Is this related to headache or eyes? They last about 20 minutes. Any further info would be great. Thanks as ever. That's Marianne. So I've never heard of an eye migraine.
Basically, these are all the part of something in a late term, they use complex migraine. Okay. And the patients, they can have aura. That's a part of aura, or atypical aura in better word.
Shapes.
Yes, that's visual aura. But the patient in complex migraine, like this is atypical form of aura called retinal migraine. Again, I don't know the patient is experienced this is a first symptom or been having. So basically the patient can have monoocular. It means the vision, they have visual change lasted maybe for 60 minutes up to 72 hours associated with the throbbing like of my typical migraine symptom. Those called retinal migraine. And for that, if the symptom is associated with the migraine symptom that called retinal. Otherwise, it could be some other conditions.
A really good question here saying, question for your expert. How do we know if there's an underlying condition or a big risk behind a headache, like potential aneurysm? That is such a good question, because I said to you off air that I find headaches in children really worrying, really sinister. And sometimes we're like, oh, I've got a headache. But at what point do you go, could this be something more? When do I need to pop a pill or go and see a neurologist?
That's a great question. So usually if any patient with the chronic who has been having headache for a long time, and if they experience the headache quality, again, I'm repeating, the headache quality is changing. Okay. For example, they are not having throbbing. Now they are having sharp pain. and at the same time they have weakness or numbness in one side or different side of the body, that is alarming. And then they look at the mirror, they see, oh, their eyelid is drooping. Again, that can lead to more vascular complication of disease. This is a part of secondary migraine. Or they have a headache where they bend,
The pressure.
or the positional. That is secondary because intracranial pressure in the brain is increasing. In aneurysm, again, aneurysm, they usually experience the slowly increasing in intensity of the headache, which is other than normal headache they experience.
I wanted to ask you about TikTok. Because we have a lot of so-called experts on social media. And I feel like just because you put, coach or expert in your bio does not make up for example, your decades of experience. And there are fads on TikTok using bands to stop migraines. I've seen people using different temperatures on feet and heads. What's your take? Effective, myth, clickbait?
Some of them are really dangerous, to tell you the truth. For example, the one you mentioned, Helen, is the band around the head. If I have, let's assume that I have a headache and I put the band around my head tight. What it happened? You're compressing the peripheral vessel, peripheral vein. You're engorging the vein. Basically, you're increasing the back pressure to the head. You're increasing intracranial hypertension, can lead to vasovagal symptom and fall and become loss of consciousness. So I do not at all recommend to listen to any patient, non-physician, for the especially band in the head. Some of them I do, like if they say they are putting cold water on the face, that, yes, makes sense. Or they are putting warm on their neck. Yes, it can relax the neck muscle, can help to contribute to ease the pain, especially in migraine.
Tell us about this new Ghatali device, because it looks like something that you might wear if you were, in Star Trek, for example. How does that work for migraine treatment?
Let me bring the patient scenario. I have a patient who is 30 years old, who use different medication for preventive measure. For example, amitriptyline, Topamax called cognitive problem, and other form of the preventive measure. And now they don't want to use any form of preventive measure. Or they want to become pregnant and they are afraid of side effect of medication. In that scenario, I like to recommend them Ghatali. Ghatali, basically, it's known as external trigeminal neurostimulation. What it does, it's very simple and understandable. Usually you it's a pad, it's a neuro device. If it is cleared by FDA, by the way, and you put it on your forehead, what it does is it stimulates or send the message through the sensory pathway above your forehead, which is we call supraorbital or supratrochlear nerve. Through the sensory, it goes to trigeminal-vascular complex, which is a transmitter responsible for pathophysiology of the migraine headache. And what it does, it increases the threshold of the pain. So what will happen, the pain threshold will increase, you don't experience pain. One important thing is we can use this in both form, acute and preventive measure.
That's what I was going to ask you. So is this a bit of kit something that you might have at home, or is it something that would be in clinic?
No, you can carry it at home. You can use it at home. You can put it on forehead for 1 hour. We have 4 more form of the neuromodulation device also as well.
Wow. So I'm just going to spell it for anyone that wants to give it a Google. It's CEFALY. Last question to you, Dr. Mohammad. I wanted to ask you about triggers, about foods. Is there anything that you advise people who struggle with headaches or migraines in particular incorporate into their diet or eliminate from their diet?
This is a very interesting question because I don't want to add harm to the patient.
We don't want to scare anyone.
Yeah, because if I ask the patient, do not take tyramine containing food. Okay?
Which would be
so
what?
It means basically we are removing all the food from the diet. So what we are adding problem to the patient. What it's causing nutritional deficiency.
And probably stress.
On the top of and stress, right? So, but some of them I emphasize, like for example, I tell them try to avoid artificial sweetener. Okay, that makes sense. You can do that. Or try to process food to have less, or avoid drinking alcohol.
Fair. Doctor, we've run out of time. We haven't run out of questions. As I said, I knew it was going to be a busy one. With your permission, if anyone wants to send me the word doctor or the brain emoji, I'll share your profile on the Mubadala Health website so people know where to find you. But you're there, Sunset Mall, Beach Road, and it's not just headaches and migraines. You treat all sorts of different conditions as a consultant neurologist. Dr. Mohammad Ghatali, thank you so, so much.
You're most welcome.
Really, really appreciate it. And as I said, if we can connect you with Dr. Mohammad, send me the word doctor or the brain emoji. I'd be very happy to send you his details so you can make an appointment to get the answers that you need one-on-one. We are going to be talking creative camps next. We're going to take to the boards with Courtyard Playhouse. First, though, we're finding out what's happening on the roads. Milani's got your latest.
Dubai Eye 103.8 traffic.
With Yas Island Abu Dhabi. Stay at iconic hotels.